know, not enough capacity exists in Canada to test everyone for COVID-19, and even if you do get tested, the results can take days to come back. Now, an Ottawa biotech company, Spartan Bioscience, has the green light from Health Canada to scale up production of its portable rapid COVID-19 test that gives results within minutes without a lab. The company has interests from all over the world, but is giving priority to Canada. Abigail Bimman explains who will get it and how it could change the dynamic of testing in this country.
The Spartan Bioscience Rapid Test, swab, cartridge, and DNA analyzer cube, all made in Ottawa, now approved to ship out.
The first version we just got Health Canada approval on gives results in less than an hour. And then our plan is within a few weeks to release a second software version that will give results in about 30 minutes.
The automatic test doesn't need a lab. It could be used at the border, in airports, in a clinic. Ottawa's priority for now is to use them in more remote areas far from central labs. And the need is clear.
We are daily getting contacts from surgeons who've had to cancel all of their elective surgeries, including for cancer patients, or Indigenous communities that urgently want these tests to test their members.
Ottawa ordered more than 1 million test kits, rolling out 40,000 a month to start.
We will get everything that this supplier will be able to provide in the coming months.
Quebec, Alberta, and Ontario have placed separate orders. Spartan calls its cube extremely accurate because it used the U.S. Centers for Disease Control's testing model.
Every test has some limitations.
Experts say with a rush to get test kits to market, more publicly released data is important.
We do need more scientific data on the sensitivity, specificity of these tests, so we know how to use them properly.
Infection control epidemiologist Colin Furness says rapid tests are badly needed to figure out how to return to a normal life one day. But there's still more figuring out to do now.
This is an asymptomatic pandemic. In other words, the usual rules of you look sick, therefore we should test you, that doesn't apply. In other words, we haven't actually developed an appropriate testing strategy.
Canada's chief public health officer says every avenue is being pursued, including looking at tests approved by other countries. But Dr. Theresa Tam warns they have, quote, significant concerns about the quality of some of them, and a Canadian review is important in the race to test as fast as possible. Abigail Bimman, Global News, Ottawa.
The limited amount of testing done now does not give a true picture of how many people in Canada have COVID-19. It's mostly the sick who are getting tested, not people with mild or no symptoms. So we have no idea what's going on in the general population. But it appears we are flattening the curve. The stringent restrictions on our lives have slowed the spread of the infection. Eric Sorensen is watching that curve tonight.
Life in Canada changed 1 month ago as we began staying home and keeping our distance. The change was so dramatic. By most measurements, Canada has done well containing the COVID-19 outbreak. One important area, the number of deaths. South Korea has been the standard, just 4 deaths per 1 million population so far. Canada is at 17 deaths per million. Better even than Germany, which has been fighting the outbreak longer, and much better than the U.S. and the U.K., though Canada is not through the surge in deaths yet.
And so I think those numbers are going to continue to get kind of scary, even though we're flattening the curve. The numbers of cases pile up, certainly the numbers of mortality pile up.
What has stood out for this country in the first month of the crisis is that the number of cases has risen steadily, but not exponentially. On a daily basis, there was a surge in March, but then things leveled off during April, a sign that the stay-at-home policies have worked.
You know, it does seem now that things are starting to get under control in terms of the infection rates that we're seeing. They do seem to be slowing down over the past few days.
Provincially, Quebec has been the hardest hit. There have been more confirmed cases of COVID-19 in Quebec than all the other provinces combined. Ontario, the numbers have a bit of a question mark because of the lack of testing, though that seems to be changing. British Columbia saw the early outbreak, but they have clearly flattened the curve since then. And Alberta may have been the best prepared province of all. They did a lot of early testing and remarkably had a lot of protective equipment to share with other provinces. Now, among the other provinces, the numbers are smaller, of course. Nova Scotia has seen the steadiest increase. That bears watching. Saskatchewan is next. They did a lot of early testing. Newfoundland had a spike in early cases, though they have leveled off somewhat. The numbers remain relatively low for Manitoba, New Brunswick, and Prince Edward Island, as well as the 3 Northern Territories. They've had very few cases, which is good news. So far, Canada has maintained enough ICU beds, though that has coincided with a disturbing number of residents in long-term care facilities who were not taken to hospital. Looking ahead, say experts, the best way to protect the vulnerable and all Canadians is with more testing.
Testing huge numbers of people, if not almost everybody in the population. And that's really the only way to get a grasp of what's happening and to be able to control it.
And, say some experts, maybe by summer, a revival of some parts of the economy.
I think in June we could start to make plans to normalizing and opening certain things like construction sites and other kinds of key infrastructure and workplaces.
But for now, the second month with COVID-19 may look much like the first, staying home and being patient. Eric Sorensen, Global News, Toronto.
The new series that goes inside the COVID-19 pandemic from the front lines.
We're still in a very critical stage of Canada's COVID-19 epidemic.
To the everyday heroes helping us cope with the unprecedented change.
We want to help because there's a desperate need.
We shouldn't fend for ourselves. We have to all come together and help each other out.
Coronavirus, the new reality. A Global News special, Sundays at 7 on Global.